Hey everyone, welcome back to my podcast, Anatomy and Physiology Bit by Bit. I'm your host, Dr. Steve Sullivan, coming to you from Bucks County, Pennsylvania, just outside of Philadelphia. I've been teaching A&P here since 2002. As most of you know, this show is all about helping students get their B or better in A&P, which is required by most nursing schools and other clinical programs. If you haven't already, I'd really appreciate you rating and reviewing the podcast with your podcast app because that really helps get the message out and make the podcast more visible so that other students and other people who are very interested in the human body actually see that we're around and available for them. Also, feel free to leave a comment if your app allows for it, like on Spotify. If you're new to this podcast, I want to first say welcome and thank you for listening. I also want to make a recommendation. This is episode 69. We're nearly at the end of what a typical 2-semester majors level A&P course would cover. In this episode, I'm going to mention a lot of things that you can review in previous episodes. The reason is that the human body and organisms in general are complex collaborations of all cells, tissues, organs, and organ systems. So in this episode, you'll hear me referencing a lot of topics I covered in previous episodes, like chromosomes, meiosis, apocrine sweat glands, red blood cells, hormones, etc. They are all pertinent to the reproductive system, but I can't reiterate them every time they come up. So my recommendation is that you go back to episode 1 and download every episode I have. You can listen to this episode now, you'll be fine, but then you should go back and start at the beginning. Or at the very least, review some earlier episodes to help you understand this one. Throughout the episode, I'll mention the previous ones that will be helpful. In the last episode, we covered a good intro to the reproductive systems, including explaining meiosis, the cell division that contributes to gametogenesis, the production of gametes. Remember that gametes are sperm and ova. Sperm is short for spermatozoan, and ovum is another name for egg. We also use the term oocyte when referring to an immature ovum that is not quite ready for fertilization. Gametogenesis is a general term. Sperm production is called spermatogenesis, and oviproduction is called oogenesis. Now the gonads, the testes and ovaries, do more than just produce gametes. They also secrete hormones. We'll discuss these hormones in detail later, but we can take a general look now. The main ovarian hormones are estradiol, progesterone, and inhibin. Not only do they contribute to the embryonic development of the reproductive system, they also regulate the female and sexual cycle and promote sexual maturation, the development of typical female secondary sex characteristics like growth of pubic hair and breasts, and the development of mammary glands in the breast so that they can secrete milk to nourish a newborn. These are the events associated with puberty, the process of reaching sexual maturity and becoming capable of reproducing, that typically takes place during adolescence. The testes mainly secrete testosterone, which stimulates the embryonic development of the reproductive system, promotes the onset of and regulates puberty, stimulates the sex drive, and sustains spermatogenesis throughout adulthood. The testes also secrete estrogens, weak androgens, and inhibin. Now, like I said in the last episode, the male reproductive system is used to deliver sperm cells to the female reproductive system. We'll first examine the anatomy of biological males, beginning with the scrotum and testes. In the biological male, the external genitals are considered to be the scrotum, gonads, and penis. Sperm production, or spermatogenesis, takes place in the male gonads, each of which is called a testis, or testicle. The plural of testis is testes. We talked about this in the last episode. The testes reside within the scrotum, which is a structure of skin, muscle, and connective tissue divided into left and right compartments by the median septum. Now, sperm production is ideal at about 33 to 35 degrees Celsius, but the average healthy body temperature is typically around 37 degrees Celsius. So to keep the testes cooler than body temperature, the scrotum is suspended from the perineum, which is that inferior aspect of the pelvic region facing the floor when in anatomical position. Using the skeletal structures of the pelvis, we can outline the perineum from the pubic symphysis to each ischial tuberosity, then converging on the coccyx. This diamond-shaped perineum results in two triangles. The anterior one is called the urogenital triangle because it contains the genitals and urinary structures. Within the urogenital triangle, from the anus to the penis, is the perineal raphe. The perineal raphe is a seam in the skin consistent with the median septum of the scrotum. The posterior triangle is called the anal triangle because it contains the anus. Deep to the slightly darkened skin of the scrotum is the dartos fascia, a combination of the smooth muscle called the dartos muscle and connective tissue. The wrinkled appearance of the scrotal skin is created by the contraction of the dartos muscle. Deep to the dartos fascia is the external spermatic fascia, followed by a muscle called the cremaster muscle, and an internal spermatic fascia. These three are continuations of abdominal muscles and aponeurosi and form the spermatic cord, which is a conduit for vessels and nerves to travel from the pelvic cavity into the scrotum and vice versa. When temperatures are warm, the dartos and cremaster muscles relax, allowing the testes to be further from the body. When they're cool, these muscles contract, pulling them up closer to the body. Deep to that internal spermatic fascia is the testis and the contents of the spermatic cord. The testis is roughly a grape-sized oval covered with two layers of connective tissue called tunics. The superficial layer is the tunica vaginalis, and it folds over itself to form a double layer, and the deeper layer is the tunica albuginea. The tunica albuginea folds in toward the center of the testis to form septa, creating lobules. Remember, septa is the plural of septum. Septum means a wall or barrier. The lobules are coiled up tubules called seminiferous tubules. This is where sperm production takes place. The seminiferous tubule's lumen is lined with an epithelium consisting of layers of germ cells and scattered supporting cells. The germ cells will become sperm, and the supporting cell, also known as nurse cells or sustentacular cells, promote the development of sperm and support, protect, and nourish the germ cells. Those supporting cells extend from the basement membrane of the seminiferous tubule all the way to the lumen. Tight junctions between them create a barrier that regulates the access of chemicals and immune cells to the germ cells. This structure creates the blood-testis barrier, or BTB, which protects the genetically unique germ cells and allows sperm to develop without being damaged or attacked by the immune system. So think about it. If those germ cells are genetically unique, that means that they don't look like all your other cells. Your immune system is on high alert for that kind of stuff. So you don't want your immune system looking at those germ cells and saying, "That's not me. I'm going to go after that. We got to get rid of it." No, we want those germ cells to be able to become sperm cells. So that barrier prevents the immune cells from getting to the vulnerable germ cells. The testis also has interstitial endocrine cells that secrete testosterone. The immature sperm produced in the seminiferous tubules are driven by pressure toward the posterior of the testis, where the tubules converge into a network of larger, less numerous tubules arranged like a cargo net called the rete testis. Immature sperm cells do not have functional tails or flagella. These are the locomotion features of a sperm. Without those, they can't move themselves. So instead of them swimming out of the seminiferous tubules toward the rete testis, they are driven by the pressure created by the production of more and more sperm cells. The rete testis then gives way to efferent ductules that lead to the comma-shaped epididymis, where sperm further develop until maturity. The epididymis, which wraps around half of the testis, has a head, body, and tail. The epididymis then leads to a long duct called the ductus deferens, which you may have heard referred to as the vas deferens. The ductus deferens travels up the spermatic cord through the inguinal canal into the pelvic cavity. Now, the reason why I bring up the term vas deferens is because you've probably heard of a procedure called a vasectomy. That is where the ductus deferens, or vas deferens, is cut, preventing sperm cells from making it to the ejaculatory duct, which we're going to get to later. That means that semen will have no sperm cells in it, which makes a person infertile, which is the point of having a vasectomy. If you don't want to have any more kids, you can have this vasectomy. They cut the ductus deferens on both sides, and now there's no sperm coming out of you. Okay, back to the spermatic cord. The spermatic cord also contains the testicular artery, testicular nerve, and a network of veins called the pampiniform plexus. Since blood is returning from the cooler testis, the blood in the pampiniform plexus is cooler than the blood in the adjacent testicular artery. As it passes the pampiniform plexus, the blood in the artery is cooled before reaching the testis. This is a way to regulate the temperature of the testis for optimal spermatogenesis. There are two inguinal canals, a left and a right. Each is a passageway connecting the pelvic cavity to the inside of the scrotum. The entrance to the canal from the pelvic cavity is called the deep inguinal ring, and the exit into the scrotum is called the superficial inguinal ring. Each spermatic cord and the ductus deferens within it travels through their respective inguinal canal. Okay, so let's follow the path of one ductus deferens carrying sperm. After making its way into the pelvic cavity, it goes around the urinary bladder to its posterior side. After it crosses the ureter, the end of the ductus deferens is dilated, forming the ampulla of the ductus deferens. An accessory organ called the seminal vesicle is adjacent to the ampulla, and they each deliver their contents into a united duct called the ejaculatory duct. The seminal vesicles contribute to seminal fluid, the fluid medium sperm use to get into the female reproductive tract. When there's sperm in seminal fluid, we call that combination semen. Seminal fluid is alkaline, which helps neutralize the acidic environment within the female reproductive tract. We don't want the low pH to kill the sperm cells. So we have an alkaline fluid in semen to neutralize that acid. The seminal vesicles secrete a viscous alkaline fluid rich in fructose and prostaglandins. The sperm use the fructose as an energy source, and the prostaglandins, which are similar to hormones, help to dilate the entrance of the uterus, so sperm have an easier time getting to the egg cell. Recall from the urinary system that the urethra of biological males is utilized by both the urinary and reproductive systems. Both left and right ejaculatory ducts carrying sperm from both ductus deferens and the secretions of the seminal vesicles enter the prostate and deliver contents to the prostatic urethra. The prostate, another accessory organ, is shaped like an acorn and is about 4 centimeters across at its widest. The prostate secretes a milky, acidic fluid containing citric acid for sperm health, seminal plasmin, an antibiotic that fights urinary tract infections, and prostate-specific antigen, an enzyme that helps keep semen a fluid after it's been released. Cells of the prostate gland undergo periods of rapid division during certain decades of life. This can enlarge the prostate and make it susceptible to mutations, leading to prostate cancer. If there is an overgrowth of the prostate, you will see an increase in prostate-specific antigen in the blood. So this is a typical blood test that biological males have done, looking to see if there is some excessive prostate activity, which could indicate cancer. Now, sometimes the prostate enlarges, but it's benign. It's not cancerous. And we have what's called benign prostatic hypertrophy, or BPH. The problem with that is, even though it's benign, the prostate grows, and remember, the urethra goes through the middle of the prostate, so the larger it gets, the more it impinges on the urethra, which makes it difficult to expel all of the urine from your bladder. Okay, so the urethra leaves the prostate and becomes the membranous urethra as it travels through a muscle called the urogenital diaphragm. Adjacent to the membranous urethra are two more accessory organs, the bilateral bulbourethral glands, also known as Cowper's glands. The ducts of the bulbourethral glands pierce the proximal region of the penis and deliver mucin into the spongy or penile urethra. The mucin forms mucus, which lubricates the urethra so sperm can pass through easily. The release of semen is called ejaculation. Each ejaculation measures up to 5 milliliters and contains between 200 and 500 million sperm. The penis is the organ used to deliver semen to the reproductive tract of the biological female. It is attached to the pelvis internally by the root of the penis, which is made up of the bulb and the crus. The shaft of the penis is called the body, with the distal head region being called the glans penis. There is a fold of skin attached to the glans penis called the prepuce, or foreskin. In many cultures, the prepuce is removed shortly after birth in a procedure known as circumcision. The spongy urethra ends at the glans penis as the external urethral orifice. If we take a cross-section of the penis, we can see several functional structures, including 3 chambers arranged like cylinders. 2 are the bilateral corpora cavernosa, located dorsally and laterally. Ventral to these is the singular corpus spongiosum surrounding the spongy urethra. These chambers are surrounded by the connective tissue tunica albuginea and divided by the median septum. Surrounding the tunica albuginea is a deep and superficial layer of fascia. We can also see the arteries that supply the penis when we're in there, which are the dorsal arteries and the deep arteries, as well as the veins that drain the blood from the penis, which are the dorsal and deep dorsal veins. Parasympathetic nervous stimulation during sexual excitement results in an increased blood flow that engorges the erectile tissues and impedes venous drainage. This results in the enlarged, stiffened state called an erection, required for sexual intercourse. Okay, so that's the anatomy of the biological male reproductive system. Now we'll talk more about the physiology. Remember that gametogenesis is a general term. Spermatogenesis refers to the production of spermatozoa, or sperm. So let's take a look at spermatogenesis. It primarily takes place within the seminiferous tubules of the testes. These tubules are lined with supporting cells, which are also known as sustentacular or nurse cells, like I mentioned earlier. Supporting cells provide structural support and nourishment to developing sperm cells. As the sperm cells develop and mature, they move closer and closer to the lumen of the seminiferous tubule until they eventually make their way into the lumen. Biological males are born with stem cells called spermatogonia, which are undifferentiated diploid cells located near the basement membrane of the seminiferous tubules. These stem cells divide by way of mitosis, resulting in the formation of 2 types of diploid cells, type A and type B spermatogonia. Type A spermatogonia stay near the basement membrane and remain stem cells so spermatogenesis can continue on into advanced age. Type B spermatogonia grow and develop into primary spermatocytes. Which reminds me, if you haven't listened to episode 68, which is my last episode, in which I cover meiosis, you should do that. I'm not going to rehash the specifics of meiosis here, I'm just going to mention when it's occurring. So if you're not comfortable with the events and stages of meiosis, pause this episode now, go listen to episode 68, then come back. Each primary spermatocyte begins to divide via meiosis I, resulting in the formation of 2 haploid secondary spermatocytes that are the same size but genetically different. Each secondary spermatocyte then undergoes meiosis II, resulting in the formation of 4 haploid spermatids. Each spermatid contains only 23 chromosomes, and while the division part of spermatogenesis is over, further development is necessary. Spermatids are immature and non-motile cells, so they must undergo a series of structural and functional changes called spermiogenesis to become mature spermatozoa.
You buy a pair of socks, that's 2 socks. You buy a pair of Bombas socks, that's 4 socks. Because one purchased is one donated. Socks are the #1 most requested clothing item in homeless shelters. So when you buy a pair of super comfortable Bombas socks, you're also donating a pair. Bombas customers have powered over 150 million donations. So Bombas would like to thank you 150 million times. But we only have like 30 seconds. Go to bombas.com and use code AUDIO for 20% off your first purchase. That's BOMBAS.com and use code AUDIO at checkout.
Hi, I'm Kristen Bell, and if you know my husband Dax, then you also know he loves shopping for a car. Selling a car? Not so much.
We're really doing this, huh?
Thankfully, Carvana makes it easy. Answer a few questions, put in your VIN or license, and done. We sold ours in minutes this morning, and they'll come pick it up and pay us this afternoon.
Bye-bye, truckie.
Of course, we kept the favorite.
Hello, other truckie.
Sell your car with Carvana today. Terms and conditions apply.
After meiosis, the spermatids remain bound to each other and to the supporting cells. However, when they reach the lumen of the seminiferous tubule, they are separated from each other and released from the supporting cells into the lumen. This is called spermiation. The constant production of new spermatids, about 400 million per day, pushes them through the rete testis, efferent ductules, and into the epididymis. There, they are exposed to secretions from the epididymis. Spermatogenesis includes the formation of the head, midpiece, and tail regions of the sperm. Most of the cytoplasm is lost, and the flagellum begins to develop. The flagellum, however, does not move the sperm until it has left the male reproductive system via ejaculation. Mature spermatozoa are stored in the epididymis until ejaculation. During sexual intercourse, contractions of the ductus deferens and associated structures propel the sperm through the ejaculatory ducts and out through the urethra. The mature sperm has two parts, the head and the tail. The head contains the nucleus, which has the DNA that is to be delivered to the egg cell, an enzyme-filled cap called the acrosome for making sure the DNA can get into the egg cell, and the flagellar basal body, where the tail is attached. The tail is the flagellum, and it provides locomotion for the sperm. Recall that the core of a flagellum is an axoneme made of microtubules. The tail is divided into a midpiece, principal piece, and end piece. The midpiece wraps around the axoneme and contains the mitochondria that synthesize the ATP needed for the flagellum to work. The principal piece is the longest part of the flagellum, where the axoneme is surrounded by supportive fibers. The short end piece is exposed axoneme with no supportive fibers. Spermatogenesis is stimulated by follicle-stimulating hormone, or FSH, from the anterior pituitary gland. Testosterone from the interstitial endocrine cells of the testis helps sustain sperm production throughout life, and its secretion is stimulated by luteinizing hormone, or LH, from the anterior pituitary gland. We'll talk more about this later on. The supporting cells of the testis secrete inhibin, which inhibits follicle-stimulating hormone to help regulate the rate of sperm production. The reproductive system is the only organ system in our bodies that doesn't really function at birth. It takes a number of years before it wakes up from a dormant state, and the process of waking it up is called puberty. During puberty, a rise in hormone levels begin preparing the reproductive system to function as it does in adults. Since this episode is covering the male reproductive system, we'll stick with the specifics of biological male puberty, which typically begins between the ages of 10 to 12 years old and ends when the first ejaculation of semen occurs. That is typically around 14 years old. The stage of life beginning at puberty and ending when a person is a full-grown adult is called adolescence. Hormones called androgens produced by the testes, which include testosterone and dihydrotestosterone, stimulate the changes seen in the body during puberty and adolescence. So let's review those changes. The first visible sign is typically growth of the testes and scrotum. This is completed fairly early on in puberty. However, the penis continues to grow for about 2 more years. Internally, the reproductive ducts and accessory glands also increase in size. So let's talk about what the two androgens are doing. Testosterone stimulates spermatogenesis. Without testosterone, there is no sperm or semen. If testosterone levels decline, so does spermatogenesis. A low sperm count means it's more difficult to fertilize an ovum and can result in infertility, which is the inability to produce offspring. Testosterone also stimulates overall body growth. The limbs elongate, increasing height. Muscle mass also increases. The larynx, commonly known as the voice box, enlarges. This causes a deepening of voice associated with adolescence. You may also notice a more prominent thyroid cartilage of the larynx. Episode 51 covers the anatomy of the respiratory system, including the larynx, so you can review that if you wanted to learn more about the different cartilages that make up the larynx. That thyroid cartilage, which is anterior, is commonly known as the Adam's apple. Males and females both have a thyroid cartilage. It's just more prominent in post-pubescent males. Erythropoiesis increases. Recall from episode 39 that erythropoiesis is the production of red blood cells. Males have a higher number of red blood cells than females and consequently a higher hematocrit. Remember, hematocrit is the percentage of whole blood made up of formed elements. As you can imagine, becoming larger means increasing the overall number of cells in our body. So the metabolic rate is also going to increase. Remember from episode 67, the basal metabolic rate is the amount of energy required for our cells to survive. Naturally, an increased BMR is accompanied by an increase in appetite. You got to eat more if you need more energy. Testosterone also stimulates the brain and libido, or sex drive. Neurons actually convert testosterone to estrogen, which is what directly stimulates the sex drive. During puberty, erections occur frequently because of the increase in libido and genital sensitivity to stimulation. Ejaculation often occurs during sleep, which is known as nocturnal emissions or wet dreams. Dihydrotestosterone, or DHT, stimulates development of hair in the pubic region, armpits, and eventually the beard area. Skin darkens and thickens, and sebaceous glands become more active. Recall from episodes 9 and 10 that sebaceous glands secrete the oily substance sebum. That excess oil mixes with dead skin cells on the surface and clogs the hair follicles. This is a breeding ground for bacteria, causing the pimples of acne. People with acne can have 2 to 20 times the normal level of DHT in their skin. The apocrine scent glands of the perineal, axillary, and beard areas develop in conjunction with the hair in those regions. Recall from those integumentary episodes that apocrine sweat glands are not for temperature regulation. They secrete odorants that signal sexual maturity. So let's talk about the hormonal control of male reproductive function. The developing testes secrete a lot of testosterone in the first 3 months of fetal development. Believe it or not, the testosterone levels of a newborn infant are nearly as high as they are in mid-puberty. However, after a few months, the testes slow down to dormancy and remain that way until puberty begins. In children, gonadotropin-releasing hormone, or GnRH, from the hypothalamus to the anterior pituitary is very low. The gonadotropins are follicle-stimulating hormone and luteinizing hormone, FSH and LH. And remember, they're stimulated for release by that gonadotropin-releasing hormone from the hypothalamus. For more detail on this relationship, review episode 35 on the hypothalamus and pituitary. During late childhood, GnRH secretion increases, in turn stimulating FSH and LH secretion. From then on, reproductive function is regulated by the hormonal relationship between the hypothalamus, pituitary gland, and gonads. This is called the hypothalamo-pituitary gonadal axis. Luteinizing hormone and follicle-stimulating hormone work together to promote spermatogenesis. So let's talk about how that happens. LH, luteinizing hormone, stimulates the interstitial endocrine cells of the testes to secrete testosterone and, to a lesser extent, other androgens. Remember, testosterone stimulates spermatogenesis. However, it needs to be concentrated in the testicular areas where sperm develop. Enter follicle-stimulating hormone. A quick side note on FSH. Follicle-stimulating hormone stimulates the maturation of ovarian follicles in biological females. That's where the name comes from. but it's still functional in males. In males, follicle-stimulating hormone stimulates the supporting cells of the testes, the ones also known as nurse cells or sustentacular cells, to secrete androgen-binding protein, ABP. ABP binds and accumulates testosterone in the seminiferous tubules and epididymis. Without FSH and ABP, the testes are unaffected by testosterone. So you can see how this hypothalamo-pituitary gonadal axis is working. Testicular development and sperm production rely on signals from the pituitary and hypothalamus. But it's a circular process. The testes also send feedback signals back to the hypothalamus and pituitary to regulate FSH secretion. Supporting cells of the testes secrete the hormone inhibin, which suppresses the secretion of FSH, reducing the rate of spermatogenesis. When sperm production is too slow, the supporting cells secrete less inhibin, allowing FSH secretion to go up, increasing sperm production. Since it doesn't inhibit LH secretion, inhibin lets us decrease sperm production without decreasing testosterone levels. If testosterone is too high, the hypothalamus secretion of gonadotropin-releasing hormone decreases, and the pituitary becomes less sensitive to it. So we can also use negative feedback within the hypothalamo-pituitary gonadal axis to regulate testosterone levels, not just spermatogenesis. So we don't want the testes to produce so much sperm that it all gets backed up. And if you're not releasing it, it has nowhere to go. So when you are producing a lot of sperm, that's when the testes recognize it, secrete inhibin to decrease spermatogenesis. When your sperm count goes low, inhibin is inhibited from release, allowing the FSH and testosterone to stimulate spermatogenesis so we produce more.
Bombas makes the most comfortable socks, underwear, and T-shirts.
Warning, Bombas are so absurdly comfortable you may throw out all your other clothes.
Sorry, do we legally have to say that?
No, this is just how I talk, and I really love my Bombas.
They do feel that good. And they do good, too. One item purchased equals one item donated.
To feel good and do good, go to bombas.com and use code AUDIO for 20% off your first purchase. That's BOMBAS.com and use code AUDIO at checkout.
So there you have it, the male reproductive system. Next week, we'll get into the female side, which is much more complex and will probably take 2 episodes. Once again, thanks for listening and subscribing. I hope you're enjoying this podcast and it's helping you get your B or better in A&P. Good luck, and I'll talk to you next time. Anatomy and Physiology Bit by Bit is a production of Minus 55 Media and is hosted by the Believe Network. Please take the time to rate my show and leave a review. You can also check out the content I post on Instagram and YouTube as @StudentHelp4AP. That's the number 4, AP. Special thanks to my family, Bucks County Community College, and McGraw-Hill Education, where your instructor can find Anatomy and Physiology Digital Suite, my low-cost tutor video-based digital learning solution for anatomy and physiology currently being used at several colleges and universities. If your instructor isn't using Digital Suite, let them know about it. The link is in the show notes.